The points that I plan to cover today, so who we are, the types of care that we can help provide as resources, what our process is, when to call, the care options, and how to get in touch with us. So myself, Vance, and I have Kyola up here as well. He's our operations manager. We do have more people on our team, but we're the most familiar faces when it comes to who will be dealing with families hands-on. And to go into a little bit about my background, before starting this company in January of 2023, I was a nurse. I was primarily an ER nurse, and I did that for a little over 10 years. And throughout that process of, helping people in the hospital and also some personal experience, we were inspired to start our company, Nursing Home Partners. And which brings me to this slide. So that's the other co-founder. His name is Paul. He's over there with his auntie. And this lady on the left, that's my grandma. And, just to give you a very brief backstory of my experience and a big part of why we started this company. So my grandmother, she used to live with us, typical Hawaii style, ohana, like everyone, co-generations living together. So she lived with us. We lived in a 2-story home, had stairs. So she had a stroke while living with us, and the stroke left her with deficits, being flaccid to one side of her body, basically. So stairs obviously being an issue. So, she couldn't safely live in our home anywhere because bathrooms are upstairs, her room was upstairs. In the event of an emergency, there's no way she could, get out of the house safely. So at the time, I was the nurse in the family. I was already working in the hospital as a nurse, actually. So, automatically, the finger kind of gets pointed at you like, hey, you're going to help us through this process. So I stepped into this role, and I was just shocked at how unfamiliar and how difficult it was to navigate all of this. So, after hospitalization, grandma goes to rehab. After rehab, we had to help find her placement. So placed her into a care home, which was, they did a fantastic job, took really good care for, but not understanding that care homes don't take Medicaid. So once grandma ran out of money and met the criteria for Medicaid, care homes don't take Medicaid. So she had to move. So, I had to move her from this care home to a foster home. And then the first foster home didn't really fit very well. So we had to hop around to several until we found the right fit. So, along this whole process, just really trying to figure out, how to do this, who does a good job, who has the openings. And it was a very eye-opening experience. And it was a big part of what inspired us to want to start this company and just be a resource for people that are in similar situations. So Nursing Home Partners, a nurse-focused comprehensive approach to senior care placement. I think a big factor that makes us a little different is that we do bring our experience as nurses and working in hospitals and doing this for our own family into this whole process. As a nurse, I try to understand, what's your medical problems? What medications are you taking? What is the prognosis of that medical problem? So, this is your condition now, but what are things going to look like 2, 5, 10 years down the road? So, we bring that understanding into the process to help people navigate all these different pieces. So, when it comes to our assessment, there's a lot of different factors, but, just very, a quick summary, taking into account all the different factors that are important when we are helping families navigate what resources are available and also what's appropriate. Because I think a big part of this process too is, I don't think a lot of people understand that depending on the type of care that you need, that's really gonna help us target what options are available and appropriate. So, when to reach out to us, a pretty broad question in my opinion. And, we like to share that there is no right time, in my opinion. I think the best would be to reach out when we're not against a wall. And what I mean by that is we come across a lot of different situations. And the most stressless situation is I don't quite need anything right now, but I want to know what's out there and what's available. And, that's a totally appropriate time to reach out to us and just start to explore, hey, I don't need anything right now, Vance, but, down the line or years from now, when I start to get closer, what do my options look like, and that conversation is a lot easier or less stressful to have. But at the same time, we also work with families that need something tomorrow. For example, sometimes we get calls from people in the emergency room. Hey, I had a fall, they're not keeping me in the hospital, but I can't go home. I need more help. Can you help me find options? And we can also help with emergent situations like that. But of course, if you can imagine being in that situation, needing something hours from now can be very stressful. So I guess just to paint the picture, we can help with those emergent situations, very stressful, but we can also help with the informational stage and just gathering, or trying to formulate a plan for when the time does come. So this summarizes like some of the more common types of care that we help our clients find. So memory care, being a big one, care homes, independent and assisted living, respite care. Actually, there's a lot of respite outreach as well. For example, families want to go on vacation, but mom and dad is no longer at a place where they can travel, but they're their primary caregivers. So to have peace of mind while they leave, a lot of times we help families find 1 2-week, 1-month respite stays so that they know that their loved one is cared for while they can go for a vacation. Another one that we've been seeing recently, just because of the season, is graduations. I think a lot of times, families want to, see their loved one graduate in the mainland and, their loved one can no longer travel. So they'll also reach out to us for like a week respite or something.
How many people do you have under roof that you can provide respite care and so forth? Or are you finding the care providers and contracting them in?
And then just for the audience at home, there's a question about how many people are employed working with Vance's team, just because there's a lot of care that's being offered.
For our company, like who works for us as employees or for the people that we partner with?
I think I'm asking the entire question. How is the personnel provided?
Sure. So our team at the moment, we have about 15 or so, that help us. And that's a combination of office staff and in-person consults like myself and Kiola and a few others. When it comes to providing the options for our clients, for one, we only work with licensed facilities or homes. So licensed meaning they are credentialed and they adhere to Department of Health when it comes to what their rules and regulations are. And, how many options we have to provide families, that's a very dynamic question. Why that is because availability. Availability is constantly changing. And that is a big part of the pieces that we bring. Yeah.
So for example, with respite care, you do provide it, but it might be or is subject to availability of outside the company personnel because you're bringing in help. That's not part of under your specific umbrella of the company.
Well, I guess to clarify, our role at Nursing Home Partners is we don't actually provide any hands-on care. What we're doing is we're understanding the situation and we are putting families in touch with a care home or a facility or a home care company that's licensed and it is able to provide the service. The options that we provide, while we're on that topic, we do vet them out. So for one, they have to be licensed, and two, we do in-home visits. So we go out, we meet these caregivers, we interview them, we look at the other residents there. We go, we look through the home. So, it's not a blind referral. We have, made some type of contact and they have been through some type of vetting process before we make the recommendation.
The services that we provided, they may be from outside independent sources, whether it's another company that provides respite care people so that families can go on vacation.
Yes.
Okay. I think you answered my question. You don't need to be.
Okay.
No, I think that brings up a good point, Colin, is because Vance was telling me earlier, a lot of the people that are contacting him are in desperate need for care, right? They need to go somewhere, right? They're in an emergency room, their parent just fell, they got to find somewhere to get help from. With Vance, he knows one, what the availability is of these places, or find the availability, and two, make sure that wherever you're getting care from has been vetted. So I think that's the hard part, like for my grandparents, was we could put them somewhere, but is that house going to be a good fit? Or is it going to be safe? Are the people there qualified? So that's where Vance helps to step in, to help us feel more certain about the decision we're making with our loved ones. So Vance himself isn't giving the care, but with his expertise, he's the one that's vetting out these different providers.
Yes. And availability keeps us busy full time. To give you just some context or just a brief idea of what that looks like. On Oahu alone, we have about 500 or 600 licensed care homes. There's about 1,200 foster homes, across the island. So at any given time, of course, some are opening, some are closing, but at any given time, you're looking at anywhere from, around 1,500 options. So, who has openings, who is qualified to provide certain types of care, again, that keeps us busy full time, just knowing who has the openings and keeping up to date with availability, because we need to know, especially for those emergent situations. Yeah, that's another part of our service and how we do help.
Vance, we had two questions that came in online. The first one was, do you ever hire independent caregivers if they are licensed and insured, even if they are not with a company?
So, that's a tricky question because usually an individual wouldn't be a home care company. And the differences, and this is what I usually share with everyone that asks me a similar question, because a lot of times, here in Hawaii, like a lot of times it's word of mouth, right? Maybe you have a neighbor, or maybe you have a friend of a friend that's a nurse or a nurse aide that you could hire and just pay cash to help you. And, to be honest, a lot of times that's the most affordable because when you pay someone cash, it's going to be cheaper than a licensed company. But what I advise people, and keep in mind, if you are going to hire someone and just pay them out of pocket or pay them cash, is that with licensed companies, they're insured and bonded. And a big part of that is if they get hurt in your home while they're providing the care, their company is going to cover them, workman's comp or through their insurance. But if you have a private person that is providing this care to you in their home and they claim they hurt their back while providing the care for you, that kind of puts you in a sticky situation. So, I think just understanding, the pros and the cons to each option. But yes, to tell you from what we see and hear, a lot of people hire people, privately to do things like that. And honestly, if you can trust them, it's a great option. But just understand, the pros and cons to it.
So just to clarify, Vance, you wouldn't necessarily hire or refer an independent caregiver.
No, we only refer to licensed companies. Licensed home care companies.
Perfect. And then the second question was, how does your referral service to a foster home differ from the guidance provided by the hospital?
To be honest, a lot of times the hospitals reach out to us to do this. But, sometimes hospitals do have like a pool of caregivers that they do work with. But, to, I guess, understand how the foster home system works. At any given time, foster homes can take up to 3 patients, assuming that they're licensed to have a third bed. When they first open, they can only have 2. So 3 beds, 1 patient in there can be paying out of pocket. The other 2 have to be Medicaid patients. So imagine having a pool of, let's say, 20 foster homes. At any given moment, if their pool doesn't have opening or availability, you kind of hit a dead end. But for us, as long as these homes are open to our vetting process and they're licensed, we will work with them, which opens it up to, again, 1,000 to 1,200 care foster homes. So how do we differ? I mean, a lot of times it's the same because we do work very closely with hospitals, and a lot of times they reach out to us when people are, or when clients or patients are in a situation where they need foster care or a care home or some type of care option right away.
So they could be working with you without even knowing.
Sometimes, yeah. But we're not the only company too. So, there are other companies that do similar services. So they might refer to others that are similar to us.
Colin, do you have a question or were you stretching?
More strict.
Okay. And there was one more question, and I think we're going to get that eventually. But I guess, Vance, how are you compensated for this? Obviously, this is such a great service that you're providing and doing a lot of work. What are your fees when it comes to your services?
Yeah, absolutely. So for our service, it is free. It is free for the families and the clients that we help. So, it is, you can, there's no commitment, we're not going to, ask for anything, but how do we get paid? How do we keep the lights on? So our company has 2 different sides to it. There is the side that we do make a profit, and we do, keep our lights on as a business, but there is a side that is actually pro bono as well. So to start with the for-profit side, we get reimbursed for our time is if we do successfully connect one of our clients with a home or a service, that home or service will pay us a one-time referral fee. So that fee is not put onto the patient or the client or the family. It's an agreement that we have with any of these services to compensate us for our time. The other side that is really a pro bono service is when we help clients that are looking for Medicaid options. And for that, we don't charge the homes, we don't charge the caregivers. It is something that is important to us to help families with, but it's not something that we are compensated for. But it does go hand in hand in what we do, because when you look at Medicaid for placement services, there's only two options. There's nursing homes and there's foster homes. And we work with foster homes so closely, it just really makes sense for us to also help people to find Medicaid placement. But yeah, to answer that question, that's the two sides to our company.
Perfect. And then just again, for the online audience, feel free to ask questions online. We'll get to them. Not sure where we were at your presentation, but go ahead, Vance.
Well, again, this is just summarizing the type of care options that we commonly help with, but, not limited to, and how to contact us. So, we do have a website. We have a number that, it's available, email, fax. So we're pretty available. It's more so what the client or the family prefers, which mode they prefer. And yeah, we are reachable. So, if there's ever any questions, again, just like reaching out for informational purposes down to needing services later today. I mean, we are available and open to help, and we're available 7 days a week, so that is another thing to mention.
And Vance, I guess, can we go back to that when to reach out slide again? I think we were talking earlier that most of your inquiries end up happening in an emergency situation, but I guess you have on the bottom right there planning ahead. So I think a lot of us thinking about what kind of facility would we like to be in, I guess where do we want to get care, right? So I guess, Vance, can you talk a little bit more about the difference between in-home care and foster homes and nursing homes? I think that for me, at least, there's a lot of confusion. I guess what is the difference between those types of care?
Yeah. Usually when clients first reach out to us, the first crossroad that we try to clarify, do we want to remain at home with supportive services, or do we want to move into a facility? Because really that is one of the bigger decisions to make, because that's gonna, the options for both are very different. So, to start with what in-home support looks like, there are several different possibilities, but one of the big ones that's fairly common is just home care. And what home care is, it's a nurse aide, basically, that would come into the home and provide assistance. What type of assistance can they help with? It's pretty broad, as long as it falls within the scope of a nurse aide. And what that means is it can't be higher level skills. So for example, they do not administer medication. They won't get a bottle, dispense the medication, and give it to you to take, because that's technically the role of a nurse. Things like wound care, you have a wound that needs changing, not something a nurse aide could do. Other common ones that we come across would be like tube feeding. Tube feeding, you need artificial nutrition through a peg or, some type of access. That is also something a nurse aide can't do. What they can do, they can help with housekeeping. They can help with meal prep, showering, any type of hygiene, toileting, changing, exercise, walking. They can take you out to your appointments. They can take you shopping. It's pretty broad what they can do. I think it's easier to say what they cannot do. Home care is a pretty common way to start services. And it's also a way for families to start, of course, assuming they have a long-term policy, to start that process. Because a lot of times you have this 90-day period. So a lot of times home care is it's a easier way to introduce outside services or, to start utilizing a policy as well. But again, we try to, once we have an understanding of what the situation is and what all the different pieces are, and we can make these suggestions, of these are the options at home. Another popular care option while at home is adult daycare. Adult daycare is a great way to get respite for the caregiver, that's providing the, majority of the help. A great way to get socialization, get out of the house, and just be engaged. Because a lot of times being at home means isolation, and isolation is not always the best thing, so adult day care or adult day health is a great option too that we recommend a lot of times to families if their goal is to be at home. And of course, it fits what their situation is.
And some daycares, they do transportation.
Some, majority of them do not. But again, we do know the ones that do. So we can also make those suggestions. Most of the ones that do transportation are in Honolulu, and they have a very, narrow radius of, where they pick people up. But yeah, so that's, the services in the home. And outside of that, you have care homes, foster homes, assisted livings, and nursing homes. When you're looking at placement in facilities or placement into a setting that is outside the comfort of your own home. And each different facility, they have their own requirements, and I guess the amount of care and the level of care is going to be a big factor into what type of facility is appropriate for the situation.
And I guess in line with that, there's a question about, does your referral fee differ between the facilities that you, I guess, refer to?
No, and it doesn't. And we purposely standardized it because we felt that if the fees were different, favoritism would come into play. So, with all our partners, it's an equal, type of reimbursement situation. But, on the other hand, we also, what's the best way to put this? We have helped connect people with services that we won't get reimbursed for. And what I mean by that is sometimes the best option is a facility that we're not partnered with. A prime example is state facilities, Leahi and Maluhia. They're state facilities. They did not partner with us. But we don't let that keep us from making the suggestion. For example, if someone lives right across the street from Leahi Hospital and they're looking for some type of long-term care option, of course, I'm going to make the suggestion and the referral. So our service doesn't just stop at where and who we're partnered with. We really have the goal of what's best for our client based off of their situation and what they're looking for. Does that answer your question?
I think it does. So a question that I think comes up is, we think about nursing homes like Arcadia, Craigside, Kahalanui, if we're so lucky. Sorry. Thank you, Colin. I'm sure Vance with senior care. Yes. Sorry. As Vance mentioned, there's with facilities. So I guess the question that comes up is, one, what is the wait list? And then two, what are the costs? Because I think, at least in my mind, that's what I envision when it comes to getting help.
Sure. So, those facilities specifically, those are basically the only facilities that have a buy-in. So Arcadia, which is Arcadia and Craigside, and Kahalanui, they have a buy-in program where, you have to give a fairly large sum of money up front. And they do a pretty thorough financial, I guess, they vet your finances as well to see if it makes sense to be a resident in these settings. But to answer your question about wait lists, so Kahalanui, last we checked, about a month ago, they're about 5 to 7 years, give or take. And Arcadia, depending on the property that you're looking into, but it was closer to 3 years, 2 to 3 years. But again, like we will, after understanding what this particular client is looking for or what the family situation is, we can make that suggestion. But with buy-in programs, it really makes sense to enter them sooner than later, to really utilize, the deposit that you're making and to utilize all the amenities and benefits to these. And a lot of times too, most times they accept at the independent living level of care. And what independent living means is that, your meals are taken care of, your housekeeping is taken care of, but everything else you're still more or less able to do. And once you get to the skilled level of care, it doesn't really make sense to enter the facility at that level of care. But I mean, certain things that are exceptions is maybe they have family there, maybe they have friends there. And that's a big, that's a selling point, to move to a lot of different places too. But yeah, so to answer your question, waitlist wise, that's what it looks like. But is that the best option for your situation? I don't know. It just depends. It depends on what's going on.
And then I guess some people envision once they get into this place, that's going to be their place for life. But I guess I learned that that may not be the case.
Yeah. And, for the most part, they do, one of the selling points is they take care of you for the rest of your life. These facilities that take this large deposit. But there are, and they're pretty good at pointing this out too, but there are certain things that cannot be accommodated. So one big one is having behavioral disturbances, primarily with dementia. Sometimes with dementia, there's agitation. Sometimes it escalates to, being physically, I guess, a physical problem. And that's a big one. And there's certain types of care, such as tracheostomy care that requires a ventilator, that most of these facilities cannot accommodate to. So, I mean, it doesn't happen very often. And I think most times these facilities really do take care of you from start to finish. But you want to have all the pieces, right? You have all the information when you are considering this big decision and what option is going to be best.
Any other questions?
Do you have an age range? Because, a person doesn't necessarily have to be a senior to have a stroke, an accident, an illness, something that renders them incapacitated, or they need home care or nursing home care or whatever.
Mm-hmm. So no, there is no age range. And you're right, we do come across, situations like that. I mean, some people too. I mean, I think a relevant population would be like spinal cord injuries. And a lot of times they can be younger. So yeah, even for them, we are a resource when it comes to just care options in general. But of course, I mean, just primarily it is, the senior population. But yeah, we've helped different age groups for sure.
So you mentioned the benefit of establishing yourself in, one of these places like Arcadia or Kahalua or Brookside soon. And we know of a couple of people who went to more than one of these places and decided, you know what?
This is not for me.
Yeah. And so what happens in those kinds of situations? I mean, they have an option of maybe saying, now is not the right time, but I'd like to, come later, or what happens?
It depends. It depends because there is certain timelines as well. I mean, 1 month versus 1 year versus 3 years. So each facility has their own policy when it comes to that. So just depending on how soon that decision is made, sometimes some of it is returned, sometimes you pass the period where it would be. And so it really just, it is situational based. Yeah. And both facilities have their own individual policies too.
So what is the worst case scenario, I guess, or like what have you seen or recently can they get their buyout back, or is it where, I mean, I know it's going to be case by case, but
yeah, I think certain situations you can lose it.
that's
But,
tough.
I mean, at that point, it's.
I would like to chime in.
Yep, go ahead, Colin.
Up-to-date information.
Mhm.
We had cases in the past where, like at Kahalua, to get in, you have to do a deposit. And back then, this is a long time ago, $350,000. So it could be a million.
It is.
The policy is if you didn't use it up and you left, they reimburse you. I think, at least with Kahalua, there's a reimbursement of whatever hasn't been spent, the deposit.
Yes.
I
But
have no idea what Arcadia is.
Yeah, but on top of the deposit, you're also paying a monthly. That's the other, thing. But that's why they do this, in-depth financial, review, before accepting anyone to ensure that, it comes close.
I think another thing that's important to realize that a lot of these continuing care facilities are actually going to vet the people that are moving in there. And if they're at a certain stage in their progression of aging that is incompatible to their facility, they're not going to accept them.
Exactly. Yes, that is a big factor when it comes to what options are available based off of the situation and the type of care that's required. Because being able to walk versus being bedbound is two very different situations and will present two very different types of options.
And just the entry fee is not the only thing they look at. You may be able to come up with the entry fee, but they do a thorough analysis of your financial situation because they want to make sure that in the worst case scenario, they're not going to lose money. That
Yes.
There's going to be enough money to carry you on through the end. And then also another restriction they put on you is that you can't give your money away.
Gifted, yes.
You can't impoverish yourself to then rely upon them. You've got to, because that could be a reason for them asking you to leave.
Yes, that is correct. And I mean, they take age, they take medical problems. It's a pretty thorough analysis, when we've met with them and asked the same questions.
Great questions. I guess the question that comes up would be, what is the cost of in-home care versus senior care living versus a foster home? Can you kind of just briefly explain the difference between the cost of care?
Yeah, for sure. So in-home caregiving, that's a fairly easy number to give. So most companies, licensed companies that we deal with, their range is anywhere from $35 to $45 an hour on average. There are some that are going to be more expensive, and there's some going to be slightly cheaper, not much. And there's different factors when it comes to pricing. For one is location. Where is the home located? Because certain areas are harder to service. And two is going to be the type and amount of care needed. So companionship versus total care to a bedbound patient is going to be is going to be different. So those factors are, considered when these companies give prices and quotes. Another important thing to mention with home care is most companies have a 4-hour per visit minimum. And at 4 hours per visit, that's where the average cost comes into play. And I think this is actually not commonly known. Let's say, what if I only need 1 hour? Or what if I only need 2 hours of care? Oh, I just need a shower. That hourly rate is not going to be $35 to $45 an hour. You're looking at closer to 80 to 100 an hour if it's a 1 to 2 hour shift, because they're taking into account travel time, incentivizing a caregiver to go out for a 1 or 2 hour shift. But yeah, another important factor to mention when you're considering in-home caregiving.
How is that compared to, I guess, foster home care costs?
Oh, yeah. So going into like independent or assisted living, which would be like the Plaza or Ilima at Lehano or Kalakaua Gardens, those are assisted living, independent or assisted living. And for independent living, Pohainani, the Ivy, those are all independent living. So independent living, it's a base rate. You pay for the unit. And, independent living meaning you only need meals and you need housekeeping, and there's no additional help or care needed. So that's very straightforward. You pay the rent for that particular unit, and outside of, those two services, you're doing everything else. What does it cost? On the low end, I've seen $4,000 a month. On the high end, depending on the facility and the size of the unit, it ranges from studios to 2 bedrooms. You can be in the $5,000 or $6,000 range, and that's for independent living. For assisted living, that's a little harder to give quotes on, because for most assisted living facilities, it's a la carte, meaning, you need medication management, okay, that's $700 a month. You need showering services, okay, that's another $400. So it really, for assisted living, it really depends on how much help you need on top of the monthly rate. To give you a rough estimate, I'd say $7,000 to $9,000. When it comes to care homes and foster homes, that's another situational answer. So all of these places are going to tell you it's going to depend on the level of care that's required. But in general, I can tell you level of care and location are going to be your 2 biggest factors. East Honolulu to Kaimuki, of course, is probably going to be your most expensive area. Windward side, coming in as a second, Kaneohe and Kailua. From Central to West Oahu, a little lower priced. But in general, I tell people starting $6,000 or $7,000 a month for these foster homes and care homes that are based out of the residential setting. Nursing homes is places like Halenani, or another one would be, like Haleolakino, or, there's nursing homes, meaning they're basically a step-down hospital. They range anywhere from $15,000 to $17,000 a month. And they have nurses on staff, they have CNAs on staff, and they function as, a rehab center and a nursing home. And placement-wise, that kind of covers all the different possibilities and price ranges in regards to those options.
I think you're giving us a range, because I want to interject that some of the cases I have are like 20 to 40,000 a month.
And-
These are Medicaid high level. I'm sure Tom probably has some data to share.
Well, there are care homes out there that will charge that rate for sure.
To 40,000, just for the audience that might not have heard.
Well, on the high end, 20,000. I have seen that. But in general, after that, it kind of, if you can afford that rate, a lot of times it just makes more sense to just hire your own caregiver to care for you in your home. because really, you're in the comfort of your own home and you have a one-to-one caregiver helping you at all times. But of course, I guess it just depends because sometimes, there are certain skill sets that are needed. But yes, I mean, it can go as high as $20,000 a month, just depending on the home and the type of care needed. But when, we're looking at just general cost and average numbers, that's the generalized answer. But yes, you're right. Some of these options, sky's the limit. But yeah, in general, those are the costs that we see on average.
We're about to hit our hour. So if there's any other questions online, feel free to send it in. Any other questions in person?
Are these costs rising every year? Yeah, I know that the general rate of inflation is one thing, but healthcare is higher, I've always thought, and this is, I'm sure, even higher than that.
Because it's been a few years since we've been doing this now, and I will say prices have increased slightly. I think when I first, started helping families, it was still fairly common to come across homes that are charging $5,000, $6,000 a month. But in general, starting rates for a lot of these places seem to be closer to $6,000 to $7,000 a month now. And this is residential style, settings. Again, it just depends because there are some places that are cheaper. Another big factor too is, a lot of clients and families rely on long-term care policies, to cover the care and to cover all these different options. And coverages and policies are changing. So that is another factor that we are seeing, but I think that's going to be a bigger problem, maybe 10 years from now. For now, I think there's still decent coverages that are, pretty helpful when it comes to covering the different types of care.
Still be here in 10 years. So.
Yeah.
But yeah, I think it's great. There's no other questions online. Any other questions in person? Vance is going to stick around in person. So we'll close on the webinar. I think Vance is such a good resource, right, for us, especially in times of need, right, for our families and even for ourselves. So just knowing that we have someone like Vance that can help us navigate this, I think is really helpful. And I know there's a lot of uncertainty when it comes to long-term care planning and end-of-life planning, right? So like I said earlier, with my grandparents, right, they kind of evolved a little bit, right? At first we were thinking about in-home care and thinking about foster homes, right? So there's a whole lot of questions that come up. So just knowing that Vance is an expert in this, that he's vetted these places and that, just somewhere we can go. And even if, like you said, if it's not somewhere that he's going to refer to, he'll point you to the right resources. So I think there's never a bad time to start the discussion. I think definitely sooner the better. Something that we ask our clients is, where do you envision when you receive care? Where do you envision that happening, right? Is it in a care home, in a senior care facility, or is it at home? So I think it's comforting, at least for me, to know that whichever option you choose, there is the services provided. So if you have any questions after the webinar, feel free to email us or email Vance. We'll send you this presentation as well. But thank you so much for joining us today.